I'll give a different perspective. There's very little that I could add. I had some disagreements with what one of the presenters said, but everybody has their right to their opinions. But basically, everybody has summarized that what we saw there was horrible. What we saw was out of the context that one would expect as a war surgeon in the population that we treated, not the nature of the wounds, but the population that we treated. Uh, oh, sorry, I'm getting an emergency alert about a tornado in my area. A tree actually fell on my house this morning. That's why I'm at the office. Um, the the but all of that aside, one of the and in retrospect, what I found myself taking care of was uh, not an excessive disproportionate amount of children. I expected that, which is why I went to Gaza. I knew that the population was 50% high school kids or younger, so I knew that the greatest population would be kids that would I be operating on and triaging. But what I didn't anticipate was the disproportionate number of targeted healthcare workers. I was there when the World Central Kitchen got targeted. I contacted the American Embassy in Tel Aviv and Jerusalem. And I called Chuck Schumer's office, who the day before just slammed Netanyahu as a quality individual. And none of them returned my communication. They confirmed that they got it. I spoke to Schumer's secretary. So we were in fear that we as healthcare workers were not being protected right in the shadow of the World Central Kitchen vans being bombed, knowing that we went through the same deconfliction process. Um, so, uh, understanding that kids were being disproportionately targeted by the numbers that would come into the ER at the European Gaza Hospital where I was at April and March, and operating on healthcare workers that survived sniper bullets, and seeing children that were deliberately hit by sniper bullets twice, which makes it a non-accident. Um, no kid gets shot twice by mistake by a sniper. That made me realize that we had to assume the role of journalists. Um, and since I've gotten back from Gaza, that's the role that I've tried to achieve. Uh, for example, I did something on CNN on Christiana Amanpour's relief interviewer. And after she asked me what my thoughts were, she said, "Well, CNN cannot independently verify that." To which I responded, and to which didn't make the broadcast. That's because you're not allowed in the country. Um, that the only people who have eyes and ears on the ground were, in fact, the doctors that were and nurses that were allowed in, the ones who are qualified to say that this is inappropriate carnage, the ones that are allowed to say, yes, I took care of a healthcare worker with a sniper bullet. Yes, I've seen a disproportion of young adolescent girls with lower extremity gunshot wounds and young boys with terminal gunshot wounds, sometimes twice. Um, we have to state, we have to become the journalists. They can take what we say and promulgate that through the airwaves, but we all have to assume that role. Having a conference with each other is very valuable, but in order to serve a purpose, I think we have to get on the airwaves and play the role as a journalist and let the world know how targeted the Palestinian population is. And I say that as somebody with Jewish heritage. We have to actually step out of our boundaries and decry that this is not Judaism versus Islam. This is Zionism versus decency. And we have to espouse the difference. If we're not political, we have to become political and state that, because our goal should be to, as surgeons, to eliminate disease and the progression of disease. But the disease is promulgated here by a 2,000-pound bomb on a tent city that's meant to bust the bunker in Afghanistan, uh, uh, marginally illicitly at that. But when on a tent city in Rafah, um, is is by no definition targeting a specific Hamas player. Um, so I think it's inane to argue whether you would take care of an injured soldier or not. No, our charge is to take care of anybody who has an injury, irrespective of their alliance. But our charge is also to prevent the progression of this disease. And the only way that we're going to do that is becoming the journalist, because Most of the journalists who were there were killed. Those that weren't killed had their equipment confiscated. Those that didn't have their equipment confiscated were imprisoned in Israel, um, or hurt so badly that they had to leave, or they were kicked out of the country. Independent journalists were kicked out of Israel. We've got to let the world know what we saw. And individually, we have to hold that banner, and individually, we have to speak to as many groups outside of our own close circle. And that would be my message. We all saw things that were horrible. We all have to now share that with social media and the legacy media, which is just now starting to wake up. They're still putting out a sterilized story. I was kicked off of X because of gratuitous gruesomeness. And my response to the office when I called them was, yes, it's gruesome, but it's not gratuitous. It's the truth. What's happening? I am a war reporter. I am the Walter Cronkite of my day because he's not allowed there. And so, if you want to have a lasting impact, if you really want to, fix more than one child and one human at a time, then speak to the public. No matter how small the venue is, it's going to make a positive impact. We've got to get the word out to outside of our close circle and share it to the public, and post pictures, tell the truth, and become a journalist. And that way, I think we'll become complete physicians. And by the way, that information needs to get passed on to the ICJ. If anybody has information on children or healthcare workers being targeted, that is the focus of the ICJ right at this moment. And if anybody knows any and wants to send that to me, you can do so. It's goodbye. I'm a hand surgeon, so it's goodbyehandpain@gmail. It's a stupid Gmail, but my patients remember it. Goodbyehandpain@gmail. Any evidence that you can help me present to the South African lawyers through their proxies, which I've already spoken to, and to the ICJ, which I've also spoken to. Let's provide data. Let's provide testimony. Let's provide photographs. If you have telephone numbers of patients that survived and are willing to testify, provide that information. Let's give the ICJ the bullets so that we can stop other bullets from flying through the air.